Let us examine the structure of the mandible. It is an unpaired bone involved in the formation of the temporomandibular joint. The mandible has the following parts: the body of the mandible and the ramus of the mandible. Two pieces. The body of the mandible has two surfaces: the external surface and the internal surface. The inferior part of the body is the base of the mandible. Watch more videos in the Easy Anatomy app. With Easy Anatomy, you can learn much easier and faster. We provide a comprehensive video library, related PDF notes, and atlas sections with engaging flashcards. Download Easy Anatomy from the link in the description. The superior part of the body is called the alveolar arch. This arch contains the dental alveoli in which the teeth are located. On the external surface of the arch, the alveoli form so-called alveolar yolks. The alveoli are separated from each other by interalveolar septa. In the anterior part of the body, there is a mental protuberance. At the bottom, on each side, it ends in a mental tubercle. Somewhat above and to the rear of the tubercle lies the mental foramen, containing the submental vessels and the mental nerve. Further back, towards the branch of the mandible, the oblique line is located. It extends upward into the temporal crest. On the internal surface of the body, along the median line, there is a mental spine. Below it, on each side, lies the digastric fossa. Above it, on each side, lies the sublingual fossa, containing the sublingual gland. Underneath this fossa runs posteriorly the mylohyoid line. And under it, the submandibular fossa is located, containing the submandibular gland. The ramus of the mandible has two surfaces: an external surface and an internal surface. The transition from the body of the mandible to the ramus of the mandible is called the angle of the mandible. On the external surface of the angle lies the mesenteric tuberosity. And on the internal surface lies the pterygoid tuberosity. There are muscles attached to these tuberosities. Above the pterygoid tuberosity lies the mandibular foramen. It extends into the mandibular canal, which ends on the external surface of the body with the already mentioned mental spine. The inferior alveolar artery and the inferior alveolar nerve pass through this canal. The mandibular foramen is covered by the lingula. The mylohyoid groove, in which the vessels and nerve are located, runs below and slightly in front. The ramus of the mandible has two processes: the coronoid process and the condylar process, which is connected to the mandibular fossa of the temporal bone to form the temporomandibular joint. The processes are separated by the mandibular notch. The articular process ends as the head of the mandible, which is located on the neck of the mandible. There is a pterygoid fovea on the anterior surface of the neck.